Good day. My name is Shanel Mutungan from BSN 1B. Today, I am going to demonstrate the transferring technique. So what is transferring technique? It is the use of proper body mechanics in repositioning, lifting, and transferring patients safely. Purpose: position and prepares clients for a variety of clinical procedure, and also the movement maintains and restore muscle tone. Equipment: bed, wheelchair or chair, and transfer belt. Procedure number 1. Check the doctor's orders and client diagnosis and restriction. Rationale: to determine any contraindications or limitations of the client's physical activity. Next, identify the client. Inform the client about the desired purpose and destination. Rationale: to reduce the client's anxiety and increase cooperation. Good day, sir. My name is Shaina po. What is your name, sir?
JB.
Sir, i-transfer po kita sa wheelchair ngayon, sir, kasi may pupuntahan lang tayo.
Sige po.
Next, assess the client's ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instruction. Rationale: to provide information about the client's physical abilities to ensure safe transferring. Good. Sir, wala pa masakit sa inyo, sir, katawan niyo, sir. Magalawin niyo po ang paa niyo. Ang kamay niyo po. Next, questions. Rationale: to prevent the transmission of microorganisms. Next, obtain equipment needed and check its condition. Rationale: to avoid accident while moving the client. Next, adjust the height of the bed to the lowest possible position. Rationale: to reduce distance that the client has to step down, thus decreasing risk of injury. Next, slowly raise the head of the bed, if not contraindicated of the client's condition. Rationale: minimizing lifting, thereby minimizing discomfort for both patient and healthcare provider. Next, place one arm under the client's leg and one arm behind the client's back. Slowly pivot the client so that the client's legs are dangling over the edge of the bed. Rationale: to support the client while sitting him or her on the edge of the bed. Next, allow the client to dangle for 2 to 5 minutes. And support client if necessary. Rationale: to allow time for assessing client's response to sitting position reduces possibility of orthostatic hypotension. Sir, wait lang tayo 2 to 5 minutes, sir, about the transfer.
Sige po.
Sir, saan po ang sir, weak side niyo po?
Sa left side.
Left side, 6%. Next, bring the chair or wheelchair close to the side of the bed. Place it at 45 degrees of the bed. If the client has a weaker side, place the wheelchair on the strong side. Rationale: to allow the client to bear weight on the strong leg. Next, lock the wheelchair brakes and elevate the foot pedals. Rationale: to provide stability. Next, put transfer belt or other transfer aid if needed and secure. Rationale: to provide safety and hold the clients without stressing joints or limbs. Next, Lifters' knee are well flexed with back straight, hands gripping each side of the transfer belt. Rationale. Transfer belt is grasped to each side of the transfer belt. It provides movement. And also, rack client's body up to standing position in the count of 3, while straightening hips and legs, keeping knees slightly flexed. Rationale. Rocking motion gives the client body movement and requires less muscular effort to lift the client. So 1, 2, 3. Next, turn the client facing the wheelchair using the pivot technique while maintaining the hold of the patient's transfer belt. Rationale. Less effort for lifter and client. Next, instruct the client to use arm to rest on chair. Rationale. To increase client stability. So, hawak lang tayo sa wheelchair, sir, para hindi kayo matumba. Next, flex hips and knees while lowering client into wheelchair or chair. Rationale. Prevents injury to client from poor body alignment. Upo lang tayo, sir, ha? Next, assess client for proper body alignment for sitting position. Support quick side with pillow if needed. Rationale. To make client comfortable. Next, secure the safety belt, place client's feet on foot pedals and release brakes if you will moving the client immediately. If the client is sitting on the chair, offer foot stall if available. Rationale. To ensure client safety. Next, wash hands. Rationale. To reduce the transmission of microorganisms. Next, record the effect of the transfer. Rationale. To provide accurate data in the care of the client.